Hello everyone, I am Shomukantagiri. Welcome to my channel. So in this video we will discuss top 10 MCQs on adrenergic drugs. Okay, in the previous two videos we have discussed about top 10 MCQs on cholinergic drug and anticholinergic drug. Okay, so this is my brief introduction. Let's start. I am giving the link of the previous two videos in the description box as well as in the I button section. Have a look. Okay, so today's first question: which of the following activates G protein gated potassium channel resulting in membrane hyperpolarization? Options are alpha 1 adrenoreceptor, alpha 2 adrenoreceptor, beta 1 adrenoreceptor, and beta 2 adrenoreceptor. Okay, you can pause the video and answer yourself, and I am explaining what will be the answer. See, the question is asking about which of the following adrenoreceptor causes hyperpolarization. What is hyperpolarization? See, hyperpolarization means chlorine will enter into your cell and potassium will efflux out from your cell. Okay, these two incidents causes your hyperpolarization. So see, alpha 1 adrenoreceptor is a type of GPCR. Okay, and alpha 2, these are also GPCR type of receptor, but alpha 1 is a type of GQ coupled GPCR. Alpha 2 is a type of GI/GO type of GPCR, whereas beta 1 and beta 2, these two are GPCR but GS subtype. Okay, so here your answer will be GIGO. See, GIGO subtype of GPCR always opens potassium channel for longer duration. Okay, and this will lead to cell hyperpolarization. So your answer will be here alpha 2 adrenoreceptor. Okay, so coming in detail with the adrenoreceptors. Okay, see, adrenergic receptors are of two types. All of you know that, alpha and beta. Alpha can be subdivided into alpha 1 and alpha 2, whereas beta can be subdivided into beta 1, beta 2 and beta 3. See, alpha 1 is present in prosthetic urethra and eye, whereas alpha 2 acts as an autoreceptor. Okay, and it is also present in postsynaptic blood vessels. Beta 1 present in heart, juxtaglomerular cells in kidney. Okay, and it can produce renin also. Okay, so beta 2 is present in bronchus, GIT, bladder, etc., and beta 3 is found in adipose tissue. Okay, so this is a brief overlook about the sympathetic receptors. Okay, so coming to the pathways and more detail about the receptors. See, alpha 1, alpha 2, these all alpha 1, alpha 2, beta 1, beta 2, beta 3, all of the 5 receptors, all of these 5 receptors are GPCR protein of GPCR, G protein coupled receptor. But here is the difference. Where is the difference? Now, alpha 1 is GQ subtype GPCR receptor, whereas alpha 2 is the GPCR, but here the protein involved is GI/GO. In case of beta 1, it is GS subtype of GPCR, beta 2 GS subtype of GPCR, and beta 3 it is also GS subtype of GPCR. So the pathway of beta 1, beta 2, beta 3 receptor after activation is quite common, because they all are GS type of GPCR, and after activation they produce CAMP. Okay, and they can also release calcium from the storage vesicle. Okay, so beta 1 agonist, selective beta 1 agonist is dobutamine, selective beta 1 antagonist is metoprolol atenolol, whereas selective beta 2 agonist is salbutamol tolbutalin. Okay, so these are the selective drugs. In case of alpha 1, it's a GQ subtype GPCR, and here IP3 DAC pathway will open and phospholipase A2 will be activated. The selective drugs are agonist, alpha 1 agonist is phenylephrine, and prazosin, doxazosin, terazosin, tamsulosin, these are the selective alpha 1 blockers. Okay, in case of alpha 2, it is GI/GO subtype of GPCR. That means it will open potassium channel and decrease the amount of CMP in the body. Clonidine is the selective agonist, eohimbine is the selective antagonist. Okay, So I am giving you a home assignment. All of you who are watching this video, please do comment the answer of this question in the comment section below. Okay, I have discussed this in this video already. Okay, so assignment number 1, which of the following receptor present in the fatty tissue? Okay, options are beta 1 adrenal receptor, beta 2 adrenal receptor, beta 3 adrenal receptor, and beta 1 adrenal receptor and beta 2 adrenal receptor, both. See, I have discussed it already. Okay, very easy question. Please do comment the answer. Then coming to the next question, the metabolic actions of adrenaline include the following except. Okay, options are glycogenolysis in liver and muscles. Yes, it is a metabolic action of adrenaline, because adrenaline can cause hyperglycemia. That means it can increase the body glucose or body sugar level. How it can be done? It can cause glycogenolysis in the liver and muscle. It can cause lipolysis in the adipose tissue. Okay, and it can cause gluconeogenesis in the liver. Okay, but here the option B is telling about that it can inhibit the gluconeogenesis, which is false. That means this will be your answer. Okay, see, metabolic effect of adrenaline is based on stimulation of two receptors. One is beta 3 and beta 2. After stimulation of beta 2 receptor, it can cause gluconeogenesis. It can cause gluconeogenesis after activation of beta 2 receptor. But whereas after activation of beta 3 receptor, it can cause breakdown of triglycerides to fatty acids. So these two mechanisms are responsible for hyperglycemic action of insulin. But here option B is telling about that inhibition of gluconeogenesis in liver. That is false. It is not the action of adrenaline. So here option B will be your answer. Coming to the next question, which of the following drugs are often found in both prescription and over-the-counter nasal decongestant? Options are alpha 2 agonist, alpha 1 agonist, alpha 1 antagonist, and beta 2 agonist. See, it's a direct question and option will be option B, alpha 1 agonist. Okay, so nasal decongestants are like nafazoline, oxymetazoline, xylometazoline. Okay, these are alpha 1 agonist, and prolonged use of these drugs can create atrophic rhinitis. It is also important. Okay. Coming to the next question, adrenaline injected with a local anesthetic, because it's a very important question. Okay, why adrenaline is injected with local anesthetics? What's the reason? See, adrenaline is injected with local anesthetics for two reasons. One is to increase the duration of action, and to reduce the systemic toxicity. These two are the major reasons. Okay, so here options are reduces local toxicity. No, it cannot reduce. Okay, and reduces systemic toxicity of the local anesthetics. Yes, it is true. Shortens duration of action. False. Makes the injection less painful. No, false. So here answer will be option B, because adrenaline is used with local anesthetic to increase the duration of action and to reduce the systemic toxicity of the local anesthetics drugs. Okay, I have already mentioned here. Coming to the next question, amphetamine potentiates the following class of drugs. Options are diuretics, option B analgesic, neuroleptics, and antihypertensive drugs. See, amphetamines are of synthetic compounds. They are very much similar of ephedrine. Okay, they are orally active compound and having CNS stimulant property. Okay, they actually release more norepinephrine into the synaptic cleft. Okay, and that can create the alertness, increased concentration, and attention span, euphoria, talkativeness, and delayed fatigue. Okay, these are the actions and consequences of amphetamines. Okay, and it is one of the drugs included for dope test. Okay, so amphetamines also have weak anticonvulsant, analgesic, and antiemetic property. That's why they potentiate the actions of antiepileptics, analgesics, and anti-motion sickness drugs. So the question is asking about amphetamine potentiates which of the following drugs? Options are diuretics, analgesic, neuroleptic, and antihypertensive. So answer will be your analgesic. This is a very factual question. You have to remember the points. So coming to the next question, choose the drug which is used as a short-term inotropic in severe congestive heart failure and has selective adrenergic beta 1 agonistic activity but no dopaminergic agonistic activity. Very, very important question. They are talking about dobutamine. Okay. So options are dopamine, dobutamine, amironone, and your salmeterol. See, dobutamine will be your answer because dobutamine is beta 1 agonist, selective beta 1 agonist, and no dopaminergic activity. Although dobutamine is a dopamine derivative, it's a derivative of dopamine, but not a dopaminergic D1 or D2 receptor agonist. It is selectively beta 1 agonist with no action on dopaminergic receptors. Okay, and it is used in congestive heart failure. Coming to the seventh question, which of the following sympathomimetic amine has agonistic action on alpha 1 plus alpha 2 plus beta 1 plus beta 2 adrenoreceptor but no action on beta 2? See, which of the following sympathomimetic drugs are having action on alpha 1, alpha 2, beta 1, beta 3 but no action on beta 1, beta 2? Options are adrenaline, noradrenaline, isoprenaline, and phenylephrine. See, this is a very important question, and the explanation of this question is very much important because from the explanation portion many questions can be asked or many questions can be framed. Okay, so here your answer will be noradrenaline because noradrenaline has no action, literally no action on beta 2 receptors. So let's see the points. Adrenaline has no action on beta 3 or weaker action on beta 3. Noradrenaline has no action on beta 2. Isoprenaline, no action on alpha receptors. Dobutamine, although it's a dopamine derivative, has no action on dopaminergic receptors. Phenylephrine, selective, it's a selective alpha 1 agonist, no action on beta. Dopamine has no action on beta 2. Okay, so this is a very, very important slide. You can take a screenshot of this slide. Okay, coming to the next question, the rate limiting enzyme in the synthesis of catecholamines. Very, very important question. In my coaching classes I have discussed already in several times. Catecholamines means two types of catecholamines are there, exogenous and endogenous. In case of endogenous catecholamines, you can name adrenaline, noradrenaline, okay, and dopamine. So all of these three are synthesized from amino acid tyrosine. All of these are synthesized from tyrosine. And see, here options are tyrosine hydroxylase, dopa decarboxylase, dopamine beta hydroxylase, and noradrenaline N-methyl transferase. Your answer will be tyrosine hydroxylase. Okay, let's understand the catecholamine synthesis process. See, all of these catecholamines are synthesized from amino acid tyrosine. Tyrosine is converted to L-dopa, and the conversion is done through your tyrosine hydroxylase enzyme. Then L-dopa is converted to dopamine by aromatic L-amino acid decarboxylase. Then dopamine is stored into the synaptic vesicle by VMAT, vesicular monoamine transporter. One type of transporter is there that stores dopamine into the synaptic vesicle. Then dopamine is converted into the norepinephrine by hydroxylase enzyme, okay, in the synaptic vesicle, and after that norepinephrine is released in the synaptic cleft. Okay, so in this whole process, one step is the slowest process, that is conversion of tyrosine to L-dopa, and that is caused by tyrosine hydroxylase, and this step is known as the rate limiting step of catecholamine synthesis. Okay, I hope it's clear to you now. Then coming to the next question, the following action of adrenaline is not mediated by beta receptors. It's also a very important question. Dilation of blood vessels, dilation of pupil, bronchodilation, and renin release from kidney. See, renin release from kidney is done through beta 1 receptor. Okay, and bronchodilation means B2 receptor is present, beta 2 receptor is present in your lungs, and bronchodilation of adrenaline is mediated through beta 2 receptor. In case of dilation of blood vessels, beta 2 receptor is present there. Okay. And only in case of dilation of pupil, there is alpha 1 receptor, and that action of adrenaline is mediated through alpha 1 receptor. Okay. So here answer will be dilation of pupil. You can see the adrenergic receptors alpha 1 and alpha 2. Alpha 1 present in eye, and beta 1 present in heart, beta 2 present in bronchus, and beta 1 also present in juxtaglomerular cell, and beta 3 present in adipose tissue. Okay. Last question of today's class: which of the following is an exogenous catecholamine? Exogenous catecholamines means options are dopamine, epinephrine, norepinephrine, and dobutamine. See, catecholamines can be classified into generally two parts. One is endogenous catecholamine and another is exogenous catecholamine. So examples of endogenous catecholamines are dopamine, adrenaline, noradrenaline, and in case of exogenous catecholamines, dobutamine, dopexamine. These are the examples of exogenous catecholamines. Okay, so this is the end of our video. Hope all of you like the video. Please like, share, and subscribe our channel. Thank you.